Hello, everyone. Welcome back to another episode in our FEMTalks series. Before we get started, I'm just going to introduce myself. My name is Pooja Patel, and I'm the current outreach director for Booster. So today I'm joined with Dr. Manasi Parikh. And before we get started, I guess, could you tell us a little bit about yourself?
Definitely. So hi, everyone. My name is Manasi, and thank you so much for having me here today. I definitely think that a platform like this is so important for all of the young women out there who are trying to make their way through the very, very confusing industry at some times. So just a little bit about myself. I was born in India and I moved to Canada when I was about 12 years old. And I guess given my exposure of living in India, I've always been interested in global health and public health. So I ended up pursuing a bachelor's degree in global health under the health sciences program at McMaster. And after those 4 years, or even during those 4 years, I actually found that all of those health disparities that I'd seen back home in India were present in my hometown of Hamilton. And it was quite shocking to see that even in a distance of about 5 kilometers, there was a difference in life expectancy of 23 years. So learning that and being someone who was very passionate about inequities and health equity, as well as the health inequalities, I decided to pursue a little bit more of public health and looking at just the health of the communities that I lived in. And through that, I actually ended up being nominated to become the student director for the Canadian Public Health Association. And I held that role for 4 years. So 3 years of my undergraduate degree, and then 1 year when I started medical school. And I also thereafter did a bunch of work with the World Federation of Public Health Associations, with the Ontario Public Health Association. And amidst all of that, applied to medical school and was fortunate enough to get in. So I finished my 3 years of medical school at McMaster, and now I'm currently a first-year family medicine resident, also back at McMaster. You can tell that I'm a little bit of a McMaster bug and a Mac lifer. But yeah, so that's just a little bit about me. I've had the opportunity to have a lot of unique experiences sitting on boards with truly like leaders in the public health field, and I've been able to use my kind of student hat in order to create a lot of programming to engage students and young professionals. So having the opportunity to talk to you all today is fantastic, and I can't wait to chat more.
It's amazing to hear so much about you and your journey. As you were saying that you wanted to kind of connect students with this whole world. So did you have any role models or mentors throughout your career that you believe were integral to your success?
Definitely. So I would say that I first had my interaction with a role model within the industry when I was actually a grade 12 high school student. So at that point in time, I was also very interested in sciences and things like that. And I actually sought out a mentor through the CIHR Youth Synapse program. And they connected me with a physician. She was a geneticist. And I was able to actually do research with her starting in high school, which was quite crazy because I didn't know the R of research or how to go about doing things. But it was really great to have someone to look up to. And this is someone that I literally 1 month ago just chatted with to catch up on life. And she's been someone who has been able to guide me not only through all of the different turns in my careers, but also in terms of career planning. So there was a time where I was thinking kind of, do I pursue public health? Do I pursue medicine? Is there a way that I can combine both? So she truly helped me with that. And then when I went to undergraduate school, the individual who nominated me to be a student director was actually the director of their Masters of Public Health program. So this was now a public health physician who had the opportunity to not only perform research with, but at the same time, she truly did inspire me and helped me maybe step a little bit outside my head. I did not at that point in time feel like I had all of the qualifications to apply to be the student director, but she was actually the individual who really helped push me in the right direction. And at the same time, again, someone who I've had the opportunity to just catch up over coffee with, and now it's turned into more of like an evolved mentoring relationship. And I do know that mentorship is something that's so important to your entire organization. And the one thing that I've learned about mentorship is that it kind of comes in stages, and your mentors come in and out in different phases. So what I mean by that is there have been times where I've had to reach out to my mentor, say weekly, and then there have been times where I've only chatted with them, every 3-4 months. And I think that ability of having a mentor who's so adaptable and so accessible at all times is something that I've really taken away from the entire situation, and definitely something that I hope to now be able to do for other, not even just young women, but just anyone. Hope to pass it along and pass it forward. So was very fortunate.
That's awesome to hear. Yes, mentorship is very important to Booster, and it's something that we focus on. So it's good to hear that you've been impacted by your mentor and they've been able to guide you. So I guess kind of on that note, what advice would you give to students who are trying to find their footing in healthcare or any industry and who are struggling with imposter syndrome?
Yeah, that's actually a really funny question, because I deal with that every single day. So now, literally in the last month or so, I've had to get used to being called Dr. Parikh or Dr. Manasi Parikh. And that in and of itself is something that takes a lot of getting used to. Before, I used to introduce myself as just a medical student or someone who's a learner. But now having just that doctor in front of my name has made things a lot more real. And I think that the biggest thing with imposter syndrome that is something that I try to do every single day is trying to remind yourself that you've gone to this point because of your own achievements. And you've gone to this point because of all of the knowledge that you've amassed over the years, all of the effort that you've put in, whether it's like countless nights studying, whether it's just countless networking lunches that you've had to go to, or whether it's just, doing things that you love that have brought you to this state. You truly are like worthy of the titles that are given to you, and you should never apologize for being that person. And it is hard because for me, imposter syndrome definitely is hitting now when people look up to you for healthcare advice, when you still are in the process of learning. But I felt that even back in second year of undergraduate studies, when I mentioned that I was elected to be the student director for the Canadian Public Health Association. And I can vividly remember this because I was sitting on this long board table with literally leaders of the public health field. And I had to not only converse with them, but also because I was trying my best to get more student engagement and more student opportunities, truly had to find a way to make my voice stand out. And what I learned through that experience was that sometimes it's honestly as simple as just truly believing in yourself and your mission. And when you're dedicated and passionate about something, no matter what obstacles or hurdles that come in front of you, you're going to be able to overcome them. So one of the things that I actually ended up doing as a part of my stint with the Canadian Public Health Association was I not only set up a mentorship program, but I actually also created a lot of forums where students and young professionals can voice their opinions and their ideas. Because oftentimes you do feel scared. You feel so nervous. You feel like you might say something stupid. You feel like you might be judged. But when you take away that element of judgment and truly just value ideas for what they are, everyone feels like they can contribute. So we'd have these monthly meetings where I would try to get all of these ideas from students. And then I also set up a blog where a lot of students and young professionals could pitch their ideas. And kind of the evolution of all of that is that I was finally successful in being able to create an entire working group that was just compassed students as well as young professionals. And we were looking at the role of technology within public health. So I tried to find like a student and our unique voices, being kind of the millennial generation, and try to find a good way to merge that with what the mission of the organization was. So I guess that's a long-winded way of saying that at the end of the day, everyone feels imposter syndrome. I literally talked to my preceptor today, who's now been a practicing doctor for about 10 years. And she still feels imposter syndrome. There's still a lot of things out there that we don't know, but I think just acknowledging that it's there and then thereafter reminding yourself that, you know what, I've done this. And if I can speak in front of a big board of directors or even give a presentation on an international world conference, I can do this. So definitely something that you have to just kind of keep getting used to, but it is definitely something that really helps if you talk to other people about it.
Definitely, as somebody who also experiences this and knows many people, especially in university, who go through this as well, it's really inspiring to hear you say that, to find comfort in saying that there's other people who also feel this way and that we can always just believe in ourselves, and at the end of the day, the work that we do, everybody can like really see it. So it's not something that we should try to hide, or that's something that we shouldn't feel proud of. So
Exactly.
moving on another note, how have you integrated your interest in women's health with the work you're currently involved in?
Again, like fantastic question. Being able to not only be a healthcare provider, but even being in the shoes of being a medical resident, a doctor, a nurse, anyone. Patients come to you telling you about some of the most vulnerable moments in their life when they might be lost, they might be hurt, they might be injured, and you truly do have that privilege of helping guide them through it. However, one thing that I've seen and realized whenever I've had interactions in women's health clinics or even women who are coming in for like their own annual physical checkup, a lot of women don't truly know or recognize what is normal, specifically with the female anatomy, with their menstrual cycles. And I can imagine or remember rather this one patient who came in and was telling me that she was passing out because of her periods every other day. And to her, this was completely normal because her mom had it, her grandma had it, and she never really reached out to anyone because that was just something that was okay. When obviously, even I saw your eyebrows, raise, we now know that that's not okay. And it's not even just the advancement in science and technology and medicine, but it's more so just the stigma that surrounds women's health topics and talking about an individual's sexual health and talking about what's normal versus not normal, whether it's coming to like your breast exams or, thinking about just women's health all in all. So I think that for me, the one thing that I've taken away from all of my current rotations, so right now I'm on an integrated women's and children's health block, is that it's so important to educate. So every time I see a patient who isn't quite sure if something that's going on is right or wrong, I think it's very important to educate patients on what normal health looks like. And a lot of times people think of doctors as people who you see a patient and they have a problem, so to speak, or they have some kind of issue or something that's bothering them and you fix it. But I would honestly challenge that a little bit and say that a lot or even more than that is just education and making sure that they also know what's normal, not just what's abnormal. So I think that definitely that's something that I want to include in my future practice. And I think that when more women start talking about their sexual health and also just their overall well-being, I think that we as an entire medical community will be able to tackle women's health a lot more.
That's amazing to hear. It's good to hear as a woman that there are people out there who are pushing women's health and making it a priority, as sometimes it is often stigmatized or many women feel embarrassed for things that are happening to them. So it's definitely great to hear. Thank you for sharing all your experiences with us and giving us great advice. So before we go, I just want to ask, is there anything else you want to share with the booster community?
I would say the biggest takeaway is truly to just remember that everything that you've done up to this point has been so instrumental in molding you into who you are today. And that person is worthy, and that person deserves all of the titles and all of the praise that's given to them. So just don't forget that, because it is really easy to second guess yourself and doubt yourself. As simple as it is to say it, it's much harder to do. So find people around you that you can talk to, find mentors, reach out to others, go to networking events, and put yourself out there, because you never know what opportunity is lying just around the corner. And I think that if you can do just a little bit of that while having probably a very, very full schedule, maybe it'll help lessen that imposter syndrome. And maybe you'll, help find your place within the industry, whatever that may be in the future. I really hope I didn't ramble too much, but it has been a pleasure.
No, it's been a pleasure on our half too. I'll definitely take everything you said with me. Your message really resonated with me. So once again, thank you. And I hope you have a great day.